Sunny here is a happy dog, but he has a huge swollen belly. For years he has had this belly, yet he is a perfectly healthy dog. The belly is simply due to his severe obesity. However, not all dogs are so fortunate. This Jack Russell here has a huge swollen belly, a condition referred to as ascites, which is an accumulation of fluids within an animal's abdomen, leading to the swollen belly. How do we know this Jack Russell has ascites?
From mild to moderate ascites, usually what we see is just an abdominal swelling. There's some abdominal discomfort. In really extreme cases, usually the abdomen is so big that there's a lot of pain. The dog sometimes becomes recumbent, so he can't move, he can't stand up, simply because there's too much pain in the abdomen.
After initial identification of ascites, the vet has to find out what the root cause of the problem is. The fluid within the animal's abdomen can tell us a lot about what is causing ascites.
Okay, basically what we do when ascites case comes in is we do what is called abdominal centesis. So what we do is we stick a needle in and we extract some of the fluid, after which we send it off for analysis.
The fluid is then sent to a laboratory for analysis, yielding information on what the cause of ascites might be.
What this analysis does is it allows us to narrow down the cause of why does this fluid build up. For example, if it's just a pure liquid with just several cells, it could be because of a heart problem, so maybe congestive heart failure. So this information allows us to narrow down the problem basically.
Ascites could be caused by several conditions, first of which is right-sided congestive heart failure. This is a diagram of the heart of a dog. The right side of the heart receives blood from the entire body before pumping this blood. This is how blood flows through the right side of a healthy heart. This valve prevents blood from being pumped back into the body. However, when there is a failure of the right side of the heart, blood begins to flow back into the body when the heart pumps. This causes a backup of blood in the abdominal blood vessels. The increased pressure on the walls of the blood vessels leads to some fluid leaking out of the blood vessels, causing accumulation of this fluid in the abdomen, causing swelling. Second, liver failure. This is a diagram of a dog's healthy liver. When the liver fails, it causes hypertension or high blood pressure. This forces fluids out of blood vessels into the abdomen. Third, kidney failure. This is a healthy kidney with its associated blood vessels. When the kidney fails, it causes increased blood pressure, just like in liver failure. This forces fluids out of the bloodstream into the abdomen. Fourth, abdominal neoplasia, or cancer within the abdomen. Several types of cancer can occur within the abdomen, depending on which organ the tumor is growing on or in. In many of these types, the tumor causes fluid to flow into the abdomen, leading to ascites. Fifth, peritonitis. The peritoneum is a membrane which lines the interior of the abdomen. When it is infected, large amounts of immune fluids rush to the abdomen to counter the infection. This leads to increased pressure on blood vessels and leakage of immune fluid into the abdomen. 6. Ruptured bladder. In a healthy animal, the bladder is a sac which stores urine. When the bladder is ruptured, this urine is released into the abdomen, causing ascites. 7th, abdominal hemorrhage. A healthy blood vessel has blood rushing through it. When a major blood vessel or a large number of blood vessels in the abdomen ruptures, they spill massive amounts of blood into the abdominal cavity, causing ascites. Relief of ascites alone is simple. In order to reduce swelling and fullness of the animal's belly, a needle is inserted into the abdomen of the animal. This is called abdominal centesis. The accumulated fluid within the abdomen then flows out through the needle. The result is a reduction in the size of the animal's abdomen, as seen in this photo of a Jack Russell which has had 500 ml of fluid extracted from its abdomen. However, as presented earlier, there are many root causes of ascites, many of which are serious health conditions and are specifically associated with a certain abdominal organ. Thus, though treatment of the animal's swollen belly may be easy, treatment of the root cause of ascites, such as heart, liver, or kidney failure, among other conditions, is much more complicated, and possible treatment methods should be assessed by the vet. Should your dog have a swollen belly like Sunny's, it may not be so fortunate as to simply be obese. Ascites is a rare disease occurring in a few animals, but the implications of it are serious. This is a Jack Russell after being treated for ascites by a vet. As you can see, the swollen belly has mostly gone away. If you notice that your pet has a swollen belly, you should bring it to a vet immediately to undergo appropriate treatment.